Hello, Team DHHS. As we approach the year's end and look forward to the holiday season and spending time with family and friends, I want to share a brief message and reflect on how the work we are doing is making our state a great place to work, play, and thrive for all North Carolinians. Let me start by thanking you. We celebrated several milestones this year, including the implementation of an electronic health record at our state-operated facilities and launching PathNC to streamline and improve child welfare services in North Carolina. We are also celebrating nearly 700,000 people receiving life-changing and in some cases life-saving health care through Medicaid expansion, and that's just 2 years after expansion was implemented in our state. We also celebrated more than $6.5 billion in debt erased for more than 2.5 million people in North Carolina. This work is changing lives and making our families, communities, state healthier and stronger. Our commitment to building a mental health care system that works for everyone also shines. We made investments in crisis care, children and families, and mental health services for people involved in the justice system. We launched the first mobile opioid treatment programs, opened new community care clinics, and launched loan repayment programs for physical and mental health care professionals. We also expanded mental health resources for veterans, for children in schools, and for teens who find themselves involved in the criminal justice system. And the list goes on with major improvements to care through this year. Everyone should feel proud of the work you are doing to make North Carolina the best place to live in the nation. As we look ahead, my goals, that is, our goals, remain the same: strengthening access to care, building a sustainable workforce, and ensuring our programs and services work for every North Carolinian. Our work is not easy, and this year we faced external challenges that made it even harder. At the federal level, our co-workers and friends faced uncertainty over their jobs as the federal government stopped funding for several long-standing programs and then shut down for 6 weeks, the longest federal shutdown in history. Even when members of our team faced uncertainty in their own roles, they continue to meet the needs of our people. Here's just one example. As part of the impact of the shutdown, teams worked long hours to ensure that more than 1.4 million people who rely on SNAP benefits received those benefits as soon as we were authorized to release them. At the state level, the General Assembly failed to fully fund Medicaid rebates. There are many more examples of selfless service at DHHS. Your dedication and perseverance helped us overcome these challenges towards our mission to improve the health and well-being of every North Carolinian. None of this progress is possible without you. You are making a difference, and I couldn't be more grateful. Next year will likely bring additional uncertainty, but we remain steadfast that we'll do our work with purpose, integrity, and honesty. I could not be prouder to lead an agency defined by dignity and where kindness prevails. Thank you for your work this year. Happy holidays, and here's to a great 2026.